Just letting people in the meeting. We'll get started in just a minute. Okay, we'll get started. Good morning, everyone. We'd like to welcome you to the Healthcare Market Oversight Program, HCMO, public listening session about the proposed deal between Care Oregon and Scan Group. My name is Suzanne Cross. I work at OHA and I use she, her, a pronouns. I'll be your host for today's listening session. Let's start with some meeting logistics. First, this meeting is being recorded. Closed captioning is available. You may access the closed captioning by clicking on the CC button at the bottom of your screen. We ask that you use Zoom to raise your hand and the chat feature if you want to share a comment. Only the hosts will be able to see the chat comments. Both the raise hand chat and the chat feature are also located on the bottom of your screen. We'll call your name and you may unmute yourself when it's time for you to share your comments. Please speak clearly and limit your comments to 5 minutes so we have time to hear from everyone. Unless you're speaking, we ask that you please turn off your camera to help prevent bandwidth issues. And screen sharing is not allowed. If you have comments or documents or materials to share, please email them to hcmo.info@oha.oregon.gov. We'll put that email address in the chat. And at the end of the presentation portion, we'll discuss how to share additional public comments via email. Okay, now we'll review the purpose of this session. The reason we're here this morning is for informational purposes only. OHA will use what we hear to inform our review of Care Oregon and the Scan Group deal. Today, OHA staff will provide high-level information about the planned deal and the review process. We'd like to hear from members, providers, or community organizations that may be affected by this deal. OHA's role is to listen and gather information. We will not be responding to questions. If needed, we can follow up to respond in writing after this presentation. Short presentation will dedicate the rest of this time this morning to hearing from the public. We'll stay on the meeting until the end, which is at 8:30. Even if there's no additional commenters, we'll do our best to get to everyone. And there is another public listening session at 4:30 this afternoon. And now I'll turn it over to the Healthcare Market Oversight HCMO program staff.
Hello, my name is Stacy DeLong. I work for the Oregon Health Authority supporting the Healthcare Market Oversight Program. I'm going to start with some information about Oregon Health Authority's review of Care Oregon's plans to combine with Scan Group. So in 2021, the Oregon legislature passed House Bill 2362 to oversee healthcare consolidation. This bill created the Healthcare Market Oversight Program, which we also call HCMO, and that program launched in March of 2022. Through the Healthcare Market Oversight Program, the Oregon Health Authority reviews healthcare business deals, such as mergers and acquisitions, to make sure that they don't harm people or communities in Oregon. If a healthcare company is planning a deal that meets the requirements for a HCMO review, that company submits a notice to OHA. Then OHA will review the deal to understand how it might affect people in Oregon. HCMO is concerned with deals that involve healthcare entities. So a healthcare entity, for the purposes of our program, is companies that provide healthcare, such as hospitals, doctors' offices, or health plans, medical groups. It also includes companies that help administer healthcare, like management services organizations. And it includes companies that control a healthcare company. An example of this might be a private equity firm. When we're doing our reviews, we look at how the transaction could affect healthcare costs, including costs for consumers and purchasers, access to care, including the availability of services and providers, quality of care, such as how it will impact health outcomes, and health equity, including how the transaction may exacerbate or address existing inequities. Okay, so what authority does OHA have? When OHA is reviewing a transaction, after we complete our review, we'll issue a decision. We can approve the transaction, and an approval means that the transaction can move forward as planned. We can approve with conditions, and conditions may include things like requirements that a company maintain existing levels of service or continue to serve certain populations. We can disapprove, and a disapproval would prevent the transaction from moving forward as planned. For deals that involve a health plan, OHA may provide a recommendation to the Department of Consumer and Business Services, or DCBS. DCBS regulates health insurers, and when DCBS is also reviewing a transaction, this means that HCMO will not issue a formal order or decision. Instead, we're just issuing a recommendation, and DCBS has the final say. This is the case for this Care Oregon and SCAN transaction. HCMO is going to be providing a recommendation rather than issuing our own standalone decision. So when we're doing a review, this is how we assess impact. So we do business and policy research, which is looking at the terms and conditions of the deal. What are some of the planned activities of the business? We also look at how similar deals have impacted healthcare in other states or in Oregon. We collect public input. This listening session falls into that public input bucket. So we seek public comments for all of our reviews. For some reviews, we may convene a community review board to understand how the potential impacts of the deal. And then we analyze data using data from the companies that are involved in the transaction, public sources, and state agency databases to understand how the current performance of the companies that are involved and how the deal might change performance. Okay, now I'd like to provide some background information about Care Oregon and SCAN's planned transaction. Again, this is intended for informational purposes. It's really a high-level overview. We have a lot more materials and information on our website related to this that you can check out if you want more information. So Care Oregon is an Oregon nonprofit company that provides health insurance benefits to more than 500,000 Oregon health plan members. Care Oregon's primary business is serving people with Oregon Health Plan and Medicaid. Care Oregon has a number of affiliated companies and lines of business. So Care Oregon operates CCOs, including Columbia Pacific CCO and Jackson Care Connect. And here, CCO stands for Coordinated Care Organization, which are regional entities that provide benefits to Oregon Health Plan members. Columbia Pacific serves OHP members in Clatsop, Columbia, and Tillamook counties, and Jackson Care Connect serves OHP members in Jackson County. Care Oregon is also affiliated with HealthShare of Oregon. HealthShare serves OHP members in Clackamas, Multnomah, and Washington counties. And Care Oregon's relationship with HealthShare is a little different from its relationship to Columbia Pacific and Jackson Care Connect. Care Oregon is one of several plans that serve HealthShare members, and Care Oregon also provides administrative and operations support to HealthShare. Care Oregon has a Medicare Advantage plan serving members who have both Medicaid and Medicare coverage, and operates a home health business as well. SCAN Group is a California nonprofit company that serves older adults. SCAN serves about 270,000 people across multiple states, and SCAN's primary business is Medicare Advantage plans. SCAN offers Medicare Advantage plans in California, Arizona, Nevada, and Texas, and they're standing up plans in New Mexico as well. And they also operate medical provider groups and services for older adults and people with unstable housing. Okay, so let's talk a little bit about what the plans are for this transaction based on what has been submitted to the Oregon Health Authority by the entities that are party to the transaction. So under the proposed transaction, SCAN and Care Oregon plan to create an organization that will serve Medicare and Medicaid members across multiple states. SCAN Group is going to be renamed HealthRight, and HealthRight plans to become the parent company of Care Oregon. As part of this deal, Care Oregon plans to pay SCAN $120 million and will become the subsidiary of HealthRight. Care Oregon will contribute $25 million to launch a charitable foundation to serve the needs of Oregonians. So what will the new company do? So HealthRight will include a Medicaid division. SCAN currently does not have the same structure, and the Medicaid division will be led by Care Oregon's president and CEO. and it'll focus on expanding Medicaid plans. SCAN and Care Oregon say that combining will allow them to compete with larger for-profit health insurance companies and provide new services. And Care Oregon has stated that it does not anticipate any changes to current services in Oregon and plans to keep current management and staffing. Okay, that was a quick, real high-level overview of the transaction. Like I mentioned, there's a lot more information on our website if you want to dig into more details. So let's talk about what's next for this transaction review. I got into this a little bit earlier on, but this transaction is subject to review by multiple regulatory processes. Each of these processes is governed by different laws and administrative rules. And this slide is really intended to provide a very quick summary of these reviews. Again, more information you can find on our program website. So there's three main reviews that we're going to cover here. There's the Healthcare Market Oversight Review, which I'm most familiar with. That's the program I support. OHA also has a Coordinated Care Organization Form A review. And then the Department of Consumer and Business Services has its Domestic Insurer Form A review. Each of these reviews have their own scope of what they're looking at. Healthcare market oversight looks at things like cost access, equity, market share, competition, and benefit to the public. The CCO Form A process looks at alignment with CCO requirements, and also leadership, control and governance, competition, equity, cost, and quality. And then the Domestic Insurer Form A process is going to look at alignment with legal requirements, financial conditions, leadership, control, governance, and competition. There is some overlap in what the various reviews cover. Each review might be looking at similar things, but will apply its own lens as part of its review. This is a quick diagram to kind of show how the reviews are related. So after the HCMO review is completed, we'll publish a report and send a recommendation to the Department of Consumer Business Services. DCBS will issue a decision following their review. And then separately, OHA's Form A process will conduct a review and issue a decision. If both DCBS and Form A are approved, the transaction can proceed as planned. If either disapproves, the transaction cannot proceed as planned. As far as timeline, there are a lot of factors that go into the timeline for these reviews. So we are aiming to complete the Healthcare Market Oversight Review in the next several months. Said this a couple times, we've got a bunch of information on our website about this transaction and the program. There's also links to the other programs on our website. If you want to find out more too, you can sign up to receive email updates on our distribution list. And as always, any thoughts or questions can come to hcmo.info@oha.oregon.gov. Okay. I am going to pass it back to Suzanne for the next section.
Okay. Public input. So we're here today because we want to hear from you. So do you want, next slide, please, Stacy. Do you have any hopes or concerns about the deal? Do you support or oppose the deal? Have you had experiences with Care Oregon or one of its coordinated care organizations? What would you like to see from the proposed new company, HealthRight? How would the deal impact you or your community? And how would the deal impact your access to care? Today's session is about hearing public comments, but you can also support or submit a written comment, as Stacy mentioned. Anyone, oh, next slide, please, Stacy. Anyone can, as we mentioned a couple times, anyone can email hcmo.info@oha.oregon.gov with their thoughts about the deal. Please mention Care Oregon in your message. Written public comments can be used in reports or in publications may be used, and public comments will be posted to the OHA's website. And as such, please don't include any sensitive or confidential information in your message. Okay, now it's time to open it up for public comment. But before we do, we just want to remind you that today OHA is here to listen. This means we won't respond to what you share, nor will we attempt to fix or resolve the question or concern that you bring today. Even though we're not responding today, we will be considering your comments in our review. We will not correct inaccurate statements that are shared as fact. We will, however, listen with careful attention, respect, and the honor that you deserve. Any public testimony is meant to provide a voice and a perspective from that individual and is not a representation of the Oregon Health Authority. Comments may be used in OHA's reports and publications, as I mentioned. And public commenters are welcome to share your video while you're presenting public comment, but please keep your video off the remainder of the meeting to help reduce our bandwidth capacity issues. And guidelines and rules for providing public comment are provided on our website. And we've pasted a link in the chat here from Zachary. And now we'll turn it over to public comment. So again, if you want to, let's see, I see Amin Tall. Go ahead, you may unmute.
Good morning. I think I gave this the early morning leadership pause, but I never want to let a cold mic happen. I appreciate being called on. My name is Andy Mendenhall. I want to thank everyone for the opportunity to offer some brief public comment. I serve as the president and CEO of Central City Concern. We're a large service provider in the Portland metropolitan area, providing healthcare, housing, and employment services. I'm also an Oregon-trained family medicine and addiction medicine physician and have lived in the Portland metropolitan area since 1991. I've been with Central City Concern for the last 6.5 years and in role as the CEO for about 18 months. And Central City Concern is very excited to see this opportunity and to have the opportunity to be working in partnership with a locally controlled, community-based nonprofit payer. And we believe that that's exactly what this merger will not only continue to create and more importantly, strengthen as we look at our partnership with Care Oregon. This is very important when we consider the general landscape of a consolidated for-profit market, in particular in the Medicaid space, which we believe is not favorable to the most vulnerable members of our community. I want to highlight that Care Oregon has, and we believe will absolutely continue to be a true safety net for Oregon's most vulnerable members, and as well as vulnerable folks. Let's also identify complex patients as well. Complex folks are oftentimes the most vulnerable. And if we consider SCAN Group, SCAN Group is a very innovative mission-based health plan that has decades of service in the areas that they've operated within, serving diverse communities with a commitment to vulnerable aging adults and houseless members of different communities in which they operate within. So the mission orientation and the history of both SCAN Group and Care Oregon gives us a lot of confidence that the histories of these organizations demonstrate deep dedication to providing quality care to vulnerable members of communities. And we believe that through that merger, the opportunity to continue that work is only going to get stronger. When I consider, and I'll close here in just a moment, what do we really want to see? What we would like to see at Central City Concern is a prioritization and continued investment in innovation. Here in Oregon, working in the Medicaid space and having trained in the Medicaid space, we're at a time where we need a focus and we need innovation to care for vulnerable aging adults in particular. Many vulnerable aging adults who have unmet social determinants needs. We also have a profound need across the entire state for deep investment, infrastructure investment in the behavioral health system of care, as well as integration of behavioral health into primary care systems. We see that within the Portland metropolitan area as we consider the homelessness, substance use, and behavioral health crisis. But we also see that aging adults, folks over the age of 60, have become the fastest growing segment of the population becoming houseless, not only in Oregon, but across the nation. So at the end of the day, we really believe strongly that Care Oregon's demonstrated efforts and commitment to working in partnership with service providers and community continuum of care is reflected as well in the history of SCAN Group, and that through the strengthening that this merger will achieve, we believe Oregon will be stronger, and the care for vulnerable adults with complex behavioral health and care needs, as well as vulnerable aging adults, will be very, very well served through this merger. Thank you for the opportunity for offering, to offer a little bit under-caffeinated public comment today.
Thank you for your comments, Andy. We'll go to Tom next, and after that, we'll hear from Gregory. Go ahead, Tom.
Good morning, and wow, thank you for this opportunity, and thanks to the Oregon legislature for this bill that created this organization to do this oversight. It's such essential work. I want to just say that as a family nurse practitioner who worked for Multnomah County for over 30 years, I have known Care Oregon since its inception in 1993. Care Oregon was founded to enhance the access to care to local communities. Today, from its own website, I think this is very important. You know, where is this in line with Care Oregon's mission? We are a nonprofit providing health insurance services to meet healthcare needs of low-income Oregonians. We are served one, and that's very important. We focus on the total health of our members. These are very things. Yeah, an element that is left out though is health share, right? Health share, we partner with communities to achieve ongoing transformation, health equity, and the best possible health for each individual. Turning this over to an out-of-state company is really not in line with these values and missions of either Care Oregon or Health Share. I think it's very important to understand, in Eric Hunter's own words, thank you, Mr. Hunter, for being on this. We do the work better than anyone else, frankly. So why this? If we're already doing the work better than anyone else, why would we turn over control of this to a nonprofit company? Once there is a board that is no longer the Care Oregon board, but that the Care Oregon becomes a subsidiary, the promises that are being made here will no longer be held in formality, because the final board will have the final say. I think it's, they use the words about being competitive. Well, they're already working with United Healthcare. While they complain about being competitive with United Healthcare, they're already in partnership with United Healthcare. And I think that's a problem, And as Eric Hunter said, in his own words, in the opt-in world, we are an afterthought. And that's what Oregon will be as this goes forward. The community members will no longer have the voice that they need to have in this arena. So the idea of turning over $1 billion of resources to this other company just does not make sense. We saw the first slide, that one of the slides that you showed, that $25 million into a foundation and $120 million to health right. Does that look like money invested in Oregon? It does not. There is no evidence to support statewide priorities and HCMO's responsibility to ensure that healthcare consolidation in Oregon supports statewide goals related to health equity, lower costs, increased access, and better quality. So when we talk about things like transparency, we already know they're redacting the documents, so information is not visible. How is that transparency? And finally, as of last November, Oregonians have a constitutional right for access to affordable health care. This transaction will strongly impede Oregon's requirement to deliver this to those living here. So I have submitted written testimony with a lot of other comments, but I wanted to highlight these items, in particular, the idea that local control will no longer be a reality. As a provider, when needed to make a call to some service center, you knew it was local. Now with this transaction, or a patient the same way, you would get some local person. Now you might get somebody, I foresee in the future, in New Mexico, Arizona, California, no longer a local person trying to help you locally. So these are a lot of red flags here. And so it's time to take a pause and keep things local. Thank you.
Thank you, Tom. We appreciate hearing from you. I'll turn it over to Dr. Carroll.
Thank you, Suzanne, and thank you for the comments, Tom. I'd like to echo Dr. Mendenhall's comments. I myself am a native Oregonian, worked, 15 years ago on the earliest iterations of Oregon CCO efforts. Was an emergency physician working really on the front lines for much of these populations. Since that time, I redoubled my efforts in that space and focused my efforts on the managed Medicaid side, really supporting individuals with complex needs. I've had the opportunity to work both in Oregon and in California during that time and continue to do so. I support this going forward in terms of this acquisition. And I think there's several reasons. And again, I'll just echo what Dr. Mendenhall laid out. You know, the scale and the innovation, the opportunity for Care Oregon that SCAN brings into this relationship is incredibly valuable at a time when there is consolidation on the competitive landscape, and that's going to accelerate. And I think that this positions Care Oregon to tap into resources. And I think as someone who's both worked, at a more strategic level, but also at a very tactical level in terms of supporting these populations, Dr. Mendenhall mentioned a really key element here, and that's the infrastructural needs that are required to be really effective in this. And SCAN has a long history that I ask all of you to take a look at in terms of bringing in and building that infrastructure, making those investments so that one can be successful in terms of really meeting people where they are and delivering on, especially on their complex needs, which most of these individuals have. And so I think I want to keep this fairly short, but again, I think these reviews are so valuable. And again, as a passionate native Oregonian, I appreciate the discourse and would be certainly happy to submit comments beyond this session. So I'll keep it brief today, but thank you all so much for your time and consideration around this, what we think is a very positive opportunity for Oregonians.
Thank you for your comments. Don't see any additional hands up, but again, if you want to speak, please send us a chat or raise your hand in the meeting. Tom, go ahead. Oh, actually, since you already spoke, let's hear from John Santa. Dr. Santa?
Sorry, I don't have a camera.
No problem.
It works well. I'll be submitting a written comment. I oppose the transaction. I'm a retired clinician and health administrator. I have been part of probably 15 to 20 mergers and acquisitions, primarily in the health insurance and delivery systems, and primarily here in Oregon. These are incredibly complex transactions, and then incredibly complex, culture changing, unpredictable upheavals in the organizations they occur in. The effects can last decades. When I was at Blue Cross Blue Shield, we did a survey, Blue Cross Blue Shield of Oregon. We did a survey in the mid-90s, primarily asking employees about their feelings about recent mergers and acquisitions. To our surprise, many of them expressed concern about the original Blue Cross Blue Shield merger, which had occurred almost a decade previously. They were still keeping track of what had happened because of that merger acquisition. So these are incredible cultural challenges. I hear this morning about infrastructure. What I'd like to ask is that OHA do an analysis of the health right organizational chart. At all discussions, I would urge that the health right organizational chart be prominently displayed, and participants ask themselves, is this the kind of organization we want to have 500,000 Oregonians and billions of Oregon tax dollars governed by? For example, in that organizational chart, there's 5 Delaware-based companies. I believe those are for-profit companies, though interestingly enough, the organizational chart specifies nonprofits, but then never uses the term for-profit for any of the other subsidiaries. So there's 5 Delaware companies. I can only figure out what's going on in 2 of them. You know, there's a company called Prosper Southern California LLC that's Delaware based, but looks like it's doing business in Southern California. What's that all about? And how much influence will these for-profit companies have on Care Oregon? There's a company called Alive Ventures, again, Delaware based. Google it, read about what Alive Ventures is up to. It's a pretty interesting, creative company. But with all due respect, what does it have to do with low-income Medicaid folks? You know, innovative, yeah. Interesting, yeah. And from what I can tell, Alive Ventures has been, quote, spun off, unquote, but it still appears on the organizational chart. So that organizational chart especially needs to be analyzed by OHA and DCBS, and details of every one of those organizational entities provided. I think I'll end my comments this morning with just a call to consider that community review board, especially under the circumstances we're in. We're still recovering from a pandemic in the midst of a huge transition in terms of eligibility. A workforce that is dispirited, confused. This is not the time for one of the best performing CCOs to destabilize the market. And believe me, when there's mergers and acquisitions, one of the biggest unpredictable elements is, what will the other folks do? What will their competitors do? This could unleash, as we saw in the 90s, incredible upheaval in segments of the market. A community review board is needed to look at this in detail before the state makes any final decisions. Thank you.
We appreciate hearing from you, Dr. Santa. Let's see, Tom.
Okay, I kept it short first time because I want to make sure everybody has space. So I'm happy to cut off anytime. Thank you again for the opportunity. But I wanted to speak particularly to, and it's in my testimony, to this issue of Medicare Advantage. Basically, Care Oregon should not become a risk of SCAN's effort to maintain and prosper in a complex environment. As we know, SCAN primarily focuses on Medicare Advantage plans, perhaps once a strategy for profitability, but the future remains uncertain. Multiple population risk reports have been submitted, and it's really uncertain about whether the requirements are being met for those services. And many advocacy groups have expressed concern that Medicare Advantage plans succeeds because of marketing and sales strategies they employ. Overall, the Medicare fund is at a time when adjustments are needed by Congress, right? Given the profitability of Medicare Advantage, but the risks are substantial in the near term, and the federal government may make adjustments that would affect profitability. Medicare Advantage profitability has largely been driven by a clever reporting and selection. The approach is not consistent with improving health equity. In addition, hospitals in Oregon are stopping accepting Medicare Advantage, and efforts in Oregon are in full swing to put dollars into the healthcare needs of communities and individuals, not profits. So, you know, and again, I echo and thank you, Dr. Santa, for your comment on that org chart. As we look at that complex org chart proposed for the future, where these CCOs become LLCs or make under this big umbrella thing, local control, again, I will emphasize, is not guaranteed in any way, shape, or form. And let's see that not as long as the board is some out-of-state company. Thank you.
Thank you for your comments. Dr. Mendenhall?
Thank you again, Suzanne. I want to honor the voices and the experience of many of the folks that have offered commentary. And, you know, as a person who is now 20 years out of residency, and I'm off script, if you will, meaning I don't have my notes. I don't have any notes on what I'm about to offer. But it's very much heartfelt. I'm deeply concerned that for as much focus as there is on the concept of local control, that if we look across other states, and I briefly for a couple of years operated in 9 different markets in New England and across the South and in the upper Midwest, opening substance use disorder treatment programming and partnering with just about every large national payer within the country during that 2-year time period. I'm very concerned that the local control that we crave, that we believe our members deserve, is something that is at great risk when we consider the trend for consolidation, acquisition of smaller community-based nonprofit health plans. And I recall Eric, that sounds overfamiliar. I recall Mr. Hunter speaking publicly about this risk, about this concern, as one of the foundational parts of why Care Oregon sought to strengthen itself. And I think I'd be remiss if I didn't comment that the way in which the for-profit consolidation pressures are happening, not just in Oregon, but across the United States, is something that I have to just speak to as a measure of conscience, because I do feel that that which we all believe in and are fighting for, I hear a lot of unity, right, around that concept of local control, is actually far more tenuous than some of us on the call maybe have identified, and I say that with respect. And that's why I see this acquisition, and I'll concede certainly that any acquisition has its risks, but the best way to be successful in merger and acquisition, and I've personally been through 2 of those, is to find like-mindedness, is to find that spirit of mission-centeredness, of client and member-centeredness. And I personally believe that that Mr. Hunter, the staff of Care Oregon, and what I've heard and what I've read in terms of my own diligence with respect to Dr. Jane and the SCAN Group team, is about as aligned and centered in keeping the member at the center of the equation during a time when the for-profit consolidation and the for-profit system, if you will, continues to inject the shareholder and the shareholder focus in a triangle that I think most of us on this call here are very concerned about. So I think I'm probably at time or have gone past my time, but I really wanted to highlight that risk and re-emphasize the importance of evaluating that risk when we consider the national market and the consolidation pattern that's taking place nationally as we look at the consolidation of community-based not-for-profit health plans by the large for-profit systems operating in multiple states across the country. Thank you.
Thank you. I appreciate everybody sticking to their 5-minute time slot. Let's see. I'd love to hear from other folks if they want to raise their hand. If you have any thoughts. I'll remind us again of why we're here today. Hoping to hear if you have hopes or concerns about the deal, how the deal might impact you or your community, how it might access your access to care for those of you who've joined late. What would you want to see from the proposed new company, HealthRight? And have you had experiences with Care Oregon or one of its coordinated care organizations? Let's see. Okay, Dr. Carroll.
Thanks, Suzanne. I think I still have a few minutes. I tried to be brief on my first in the anticipation of some potential additional comments. Again, echoing comments made, and again, at the risk of being overly familiar, Andy's comments, also the other individuals, much appreciated. I have firsthand experience working deeply with Care Oregon around behavioral health efforts for the underserved Medicaid population. Also across the broader California market, have seen firsthand both entities and both environments firsthand. I think speaking again to the leadership element around SCAN, I think everything Andy said around the consolidation piece, and I know we've already certainly covered that. I think that circus is coming to town, if you will. And what I would say in support of Dr. Jane and his leadership and their team, Dr. Jane, for myself, was one of the inspirations in terms of the work that he had done throughout his career. He's really been a thought leader and a absolutely mission-driven individual around addressing the needs of people on the ground. And that's just been a thread throughout his career. And I encourage anyone to do their own research around that. And I think this is, again, to have his leadership involved, certainly at arm's length to an element, would only benefit, add to the incredible work that people are doing on the ground in Oregon. And I'll close here and just say I make myself available to anyone that would like a bit more perspective, both within the Oregon environment and outside of that. And then also to give a little more context from a leadership perspective and what I've observed from SCAN's leadership team. Again, thank you all so much for your time this morning.
Thank you for your comments. Folks want to raise their hand if they have thoughts, or feel free to put them in the chat. We'd love to hear from community, providers, additional providers. Do you have hopes or concerns about the deal? Do you support or oppose the deal? Have you had experiences with Care Oregon? What would you like to see from the proposed new company, HealthRight? How would the deal impact you or your community? How would the deal impact your access to care? Feel free to raise your hand or put yourself off mute if you would like to comment. In the awkward silence, as a reminder, we will keep this public listening session open until 8:30. We appreciate the voices and perspectives shared thus far. Thank you, Mary Lou Henrich. Oh, you're on mute. Hold on, we can help.
Okay, my name is Mary Lou Henrich, and I've been sitting here thinking I'm not going to comment, and I don't have any prepared remarks. I was the first executive director, CEO of Care Oregon in 1994, when we started on February 1st with 10,000 members. And as I feel like I'm, am I looking at this in terms of too much old and the way it was and in the past and all of that? But I was there for 10 years and saw a lot of change, a lot of growth. And in those days, we were MCOs, managed care organizations. And then over time came in the CCO concept. And Dr. Mitch Greenlick was a real leader in this whole concept of having these coordinated care organizations across the state that were community-based, that really looked at, geographic focus on particular needs for the Medicaid population. I was here when the Oregon Health Plan actually started, in February 1st of 1994. So one of my questions, I'm not sure, kind of where I come down on this, because as I've told people, I don't drive from the back seat. And once I left the front seat, I have just been another community member who has kind of been out there supporting constantly the safety net and low income populations in many other roles after I left Care Oregon. So, I want this to be heard in the spirit of just kind of questioning the whole, what will this do to the whole concept of statewide CCOs? I'm not sure. It does make me nervous. I lived in California a short period of time of my life, but have been a native Oregonian for most of it. And, Oregon has always had this bit of like, we do it different here. We're in Oregon, stay out California. So I'm trying to kind of put that in perspective and say, no, just because they're California doesn't mean that they're not good. I do echo some of the concerns that Dr. Santa raised, who actually, when we formed Care Oregon, Dr. Santa was one of the people I met with who basically said, what are you doing this for? We don't need another organization. We've got Blue Cross, we've got Kaiser. Why would we need something called Care Oregon? And I said, well, it was because two people who were the leaders at the time from OHSU and Multnomah County both felt that we needed to form something that was more of an integrated delivery system. And I was tapped to help make that happen. So I've known John for many years, and I really respect his experience with mergers and acquisitions. I've never been part of that world. It does, I think, need to be taken very carefully and looked at. I hear what Dr. Mendenhall is saying, and I've read some other positive comments from Commissioner Sharon Myron. And so I'm trying not to be kind of like this old lady sitting out here going, oh my gosh, the sky's falling. I just think, I hope that it's all done very carefully, and all of those pieces that have brought up about the SCAN organization that I really don't know much about. I noticed that Colleen Kane is on their board. Colleen used to be in Oregon, and a very bright woman, and a very committed person for all these years. So, I kind of go, well, Colleen is there. So anyway, I hope I'm just not rambling too much, but I just want to say that I've been very proud of Care Oregon's growth over the years, the services it's provided. And, when one leaves an organization, there's the time later when somebody will say, oh, my son is on Care Oregon. And then I kind of just tense up a little bit and think, okay, what are you going to say? And 99 times out of 100, people have said to me, Care Oregon has saved my child's life, has been a marvelous organization, providing great care, and the leadership that came after me grew it, changed it, but made it better, bigger, stronger. And I am just a little skeptical of this kind of concept that there's this movement out here that's going to be eating everything up if we don't do this. I do like the idea and think that the whole CCO concept of local control and regional control really has been the basis. And I'm a little concerned about that. So that's all. And thank you very much for the opportunity. And like I said, I was not planning to say anything this morning, so my comments were just really pretty much off the cuff. Thank you.
Thank you. We appreciate your comments. You actually miraculously kept it exactly to 5 minutes.
Did I? Okay, great.
And just as a reminder to those of you who are just joining, we're here to listen today and hear input from community members about the proposed deal between Care Oregon and SCAN Group. And we'll use the public comments to inform our review.
Suzanne, we have a commenter who wasn't able to use their camera, but I'm just going to go ahead and read the comments Elise Thompson provided in the chat. With HealthRight being the parent company of Care Oregon, how will this impact Care Oregon's autonomy and existing contracts? Could this merger create another level of administrative burden to the provider community, i.e. will HealthRight have its own set of required reporting, oversight, etc.? Thanks, Elise, for sharing those comments.
Thank you. Again, if you're unable to come off mute and speak, you're welcome to put your comments in the chat to one of the hosts, and we will read it out loud for the group. And we'll stay on the line in case others join. Let's see, I see someone came off mute. Mark, would you like to make a comment? No, okay. We appreciate everyone who's given their perspective and comments today. I'll review again if anyone wants to submit a written comment. You can email hcmo.info@oha.oregon.gov with your thoughts about the deal and mention Care Oregon in your message. And we'll use those public comments as we are today, using the comments that we're listening to in our reports and publications. We will post them on our OHA website, and again, make sure not to include any sensitive or confidential information for that reason. Again, thank you for the voices. And we will be on the line in case anyone joins until 8:30. Again, here's some prompts about what we'd like to listen for today. Feel free to raise your hand if you want to, or send us a chat. If you have anything to share, we'll be here till 8:30, and we appreciate all the comments that we've heard this morning. Thank you again to everyone who came and shared their voices and comments. Again, we'll be leaving this public listening session up until 8:30. And we'd love to hear from community if you have any hopes or concerns about the deal. And the questions that are showing up on your screen, feel free to raise your hand or send us a chat to share your comments. Thank you. So those of you who are just joining, feel free to raise your hand or put a chat in the chat at the bottom of your screen if you would like to share public comment. We appreciate everyone who's shared their thoughts this morning. Thank you. To anyone who's just joined, we are soliciting comments, the questions we're hoping to hear from the community providers and community organizations are on the screen. And if you'd like to make a comment, please use the raise hand feature or send a chat to the host and we can call your name and unmute you. We're going to stay on the call until 8:30, whether there's comments or not. And we appreciate everyone we've heard from today already. Thank you.
I just wanted to speak quickly to a question that I received in the chat asking about when, if there's a deadline for public comments. We don't currently have a deadline for public comments. As I mentioned, the HCMO review is aiming to complete in the next several months by early 2024, and we'd like to receive all comments prior to completing our review. The earlier we receive comments, the better. Therefore, we can incorporate that into our review and inform what we're looking at. So again, if you'd like to provide a written public comment, you can email us at hcmo.info@oha.oregon.gov.
Again, for those of you just joining this morning, feel free to share a comment by raising your hand and you can unmute yourself, or you're welcome to share a comment in the chat. And we're grateful to everyone who shared their comments this morning. For those of you just joining, we have heard a number of public comments about the Care Oregon and SCAN plan transaction this morning. If you'd like to provide a comment, please raise your hand or notify the host in the chat. And we will stay on the call until 8:30, whether there's commenters or not. Thank you.
Okay, we received another comment from Chris Send that I'm going to read. The comment says, respectfully, we already have for-profit out-of-state organizations operating CCOs in Oregon, so that ship has sailed. This is an opportunity for a local Oregon branch of a larger nonprofit company to maintain local control with the same local board of directors it has always had. The Care Oregon board will continue to operate independently and make the best decisions for Oregonians. Care Oregon's Medicare Advantage plan serves people who are dually eligible for both Medicare and Medicaid, and it currently competes with more than 30 for-profit Medicare Advantage plans who often use prohibited marketing tactics because they are so huge that the millions of dollars in fines CMS launches against them have no demonstrable effort on their profitability and are not a deterrent. Competition for the most vulnerable of our populations is heated, and without the resources to absorb the annual business losses from the Care Oregon Advantage Plan, the future for these members is uncertain. Thank you, Chris, for your comments.
Thank you for your comments, everyone who's commented this morning. If you wish to add an additional comment, please feel free to unmute yourself or put it in the chat and we'll read it out loud. Again, as a reminder, public comments will be posted to the OHA's website, and written public comments may be used in reports and publications. And we're grateful to hear from you this morning. Thank you. Welcome to those of you who are just joining. We're hearing public comment this morning. If you'd like to provide a comment, please raise your hand or notify the host in chat. We're happy to have heard from the numerous voices we've heard from this morning. There's some prompts up on the screen, and we'd love to hear from the community, from providers, from community organizations who will be impacted by the deal. Thank you. Feel free to raise your hand if you'd like to make a comment. Again, I want to thank everyone who shared their thoughts with us this morning to inform our review regarding the Care Oregon Scan Group deal. We have just 5 more minutes on this public listening session. And as a reminder, we have another one later today from 4:30 to 6 p.m. We're grateful for everyone who shared their comments with us this morning. And if you'd like to share more, please feel free to raise your hand, unmute, or send a message in the chat to the hosts. Thank you. Once again, I want to thank you on behalf of OHA. We're grateful to the voices and perspectives that we heard today. And feel free to join the next public listening session at 4:30 this afternoon. Again, just as a reminder, we can receive public comments on our website and email hcmo.info@oha.oregon.gov. We can put that email in the chat as well. Thank you, everyone.
Thank you.